Hello, my name is Albina Minlikeeva and I'm a clinical assistant professor at the Department of Epidemiology and Environmental Health. I also teach in an undergraduate public health program and involved in some disability-related work. Approximately 26% of the United States adult population report having disability. This population is disproportionately affected by various health disparities. They experience higher prevalence of various behavioral risk factors, for example, smoking, e-cigarette use, unfavorable dietary habits, and insufficient physical activity. The findings of various research studies also found that people with disabilities are at a higher risk of developing heart disease, diabetes, depression, and high blood pressure. They also experience oral health disparities. Altogether, these unfavorable health-related issues result in a higher mortality experienced by people with disabilities compared to people with no disabilities. They also are affected by the social determinants of health at a larger extent compared to individuals with no disabilities. People with disabilities report having fewer friends, less social support. They experience environmental barriers, including inaccessibility of the buildings, and lack of educational opportunities. This population is also at a higher risk of being unemployed and receiving lower salaries compared to people with no disabilities. They also experience a limited healthcare access. According to the CDC, only 1 in 4 adults with disabilities report seeing healthcare providers on a regular basis. And 1 in every 5 adults with disabilities report having the healthcare needs being unmet because of the cost of the medical care. Stigmatization, ableism, implicit and explicit biases directed at people with disabilities can significantly affect their health. Public health plays a fundamental role in advancing health equity among people with disabilities through incorporation of various programs that are related to health promotion and disease prevention. The strategies that address various environmental and social factors affecting this population. Promoting inclusion of people with disabilities in public health programs and their participation in social activities can foster health equity and address health disparities in this population. Some ways to make contribution in promoting health equity among people with disabilities could be being a volunteer and helping local organizations working with people with disabilities. Attending local events that are hosted by these organizations, and also include people with disabilities in various social activities and events. Together, we can make a difference and promote health among all individuals.